Cerebellar signs. Cerebellum is an infratentorial structure in the posterior cranial fossa. It has two lateral lobes and a central vermis. Functionally, it can be classified as paleocerebellum, responsible for maintaining posture, archicerebellum, for maintaining equilibrium, and neocerebellum, for voluntary movements and coordination. Following are signs that can be elicited in disorders of various cerebellar functions. The mnemonic DANISH is commonly used to recall the important cerebellar signs. Lesions of the paleocerebellum result in abnormalities of posture, stance, and gait. Hypotonia is the decreased tone of muscles. To test hypotonia, feel the tone of the muscle at its belly and gently try to move it in a direction opposite to its fibers. In hypotonia, the muscle feels lax. On performing the knee jerk, a pendular reflex is observed due to hypotonicity of the muscles of the knee. Lesions of the neocerebellum result in intention tremors and dysmetria. Intention tremors are involuntary, rhythmic muscle contractions that occur during a purposeful voluntary movement, the intensity of which increases upon reaching the target. They are observed if there is involvement of the cerebellar afferent pathways in their connection with the red nucleus and thalamus. Dysmetria is inability to arrest movements at the desired points due to loss of ability to gauge the distance, speed, and power of movements. Both intention tremors and dysmetria are tested by the finger-nose test. To perform the finger-nose test, the examiner holds out his finger, the patient is asked to touch the examiner's finger, and then his own nose. He is then asked to repeat the action more quickly. Abnormal test may indicate both dysmetria and intention tremors. Clinically, dysmetria may present as overshooting or undershooting of the finger during the test. Intention tremors become more prominent as the patient's finger approaches his nose. Heel-shin test is the lower limb equivalent of the finger-nose test. With the patient lying supine, ask him to place his heel on his opposite knee and slide his heel up and down the shin. Rebound phenomenon, or Stewart-Holmes sign, is complete failure of the antagonists to counter overshooting. With closed eyes, the patient holds out his hands, with palms facing upwards. Apply downward pressure on each arm, while the patient tries to push upwards to maintain his position. Immediately remove the resistance. Normally, the patient will be able to stop his hand due to antagonist action of the cerebellum. If not, it is suggestive of cerebellar diseases. Dysdiadochokinesia is the ability to perform diametrically opposite actions rapidly. It is enabled by antagonistic movements controlled by the cerebellum. To perform Dysdiadochokinesia, ask the patient to place the left palm over the right palm and perform rapid pronation and supination movements. In cerebellar ataxia, the patient struggles to perform the task, movements appear slow and irregular. Some signs observed in cerebellar disease, but do not help to diagnose the site of lesion, include ataxic gait, nystagmus, speech disturbances, and vertigo. Ataxic gait is seen in acute cerebellar ataxia. When the patient is asked to walk, the patient walks with their feet wide apart, known as wide-based gait, and resembles persons who have ingested excessive alcohol. In unilateral cerebellar lesions, the patient may fall towards the side of the lesion. Nystagmus is repetitive, uncontrolled movements of the eyeballs, which result in depth perception and can affect balance and coordination. With the patient in sitting position, hold a finger in front of the patient at eye level, at arm's length from the patient. Ask the patient to focus on the tip of the finger. Look for any involuntary movements in the eye. Then move the finger to either side and repeat. Scanning speech is a type of ataxic dysarthria, in which spoken words are broken up into separate syllables, often separated by a pause, and spoken with varying force. It is a typical symptom of multiple sclerosis. To get more such high-yield medical content, Don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.